Good afternoon, everyone, and thank you for joining us on the news briefing this Wednesday, July 1st. Well, no matter where you are in Monterey County, you are probably hearing the sounds of fireworks where you live. 4th of July holiday is just around the corner. So it's very important to know when to call emergency responders about fireworks that you may see, where fireworks are and are not allowed, and also what fireworks can mean to the threat of wildfires in our area. So for that, we're very pleased to have joining us today Matt Lumadue. He's fire prevention specialist with Monterey County Regional Fire District. Also Curtis Rhodes, CalFire BEU, both here to talk about fire safety. Matt, I'm wondering if we might be able to start with you, because I think you've got a great presentation on what people should know about when and where they can use fireworks.
Yeah, thank you, Mia. Thank you, everyone, for being here today. To be honest, I don't have a presentation, but I do have some pointers that I would like to talk about. We go over this every year, and looking at the attendees on the list of people here, a lot of us are from the county or from an organization where we talk a lot about this to the public. But for those of us that are public and are able to share this information with the public, I really thank you for trying to share this with people. I think the more that we share the valuable information with everybody, the more word gets out. And to your point, Mia, yes, I live in Seaside, so I have been hearing the fireworks every night for about 2 weeks now. Not to beat a dead horse, but I think the majority of us know what some of the safety regulations are and the things that should be taken into consideration when using the safe and sane fireworks. Please know that any fireworks that leave the ground are illegal. If you are going to be using fireworks in a safe and sane area, such as the cities where they are allowed, like Salinas proper, inside of Gonzales proper, the very center of the cities where they are allowed is the only places you can take fireworks. Please do not take them outside of the areas you buy them, because not only is that illegal, but the reason for it is it's because it's dangerous. As soon as we take fireworks into the more rural areas, the chance of ignition of a wildfire is much greater. So of course, we don't want to light any fireworks near grasses, any bushes, anything like that. If you are using the safe and sane fireworks, make sure that you buy them from a licensed dealer that does carry the state fire marshal's stamp of approval. Also, all products that you buy should have that same stamp of approval as well. And again, make sure to use them in a safe area within the city limits that you bought them. Transporting them, again, is a crime and carries a hefty fine, as well as launching off any fireworks that are illegal in illegal areas. Up to $1,500 a fine per firework that leaves the ground. So if we could really try to emphasize that to people. First off, I want to wish everyone a very happy and safe 4th of July. I personally don't think there's a lot of ways that we're going to be able to curb illegal fireworks, but I think the more that people realize how dangerous they are, not only to themselves, to their property, but to the surrounding areas, it may start to lend a little bit of a hand of education to people. And that's really what I'm hoping that we can all team up to do, is try to educate people a little bit better. I can't wait to hear what Chief Curtis Rhodes has to say. CalFire is definitely a leader in fighting of the wildland fires, and they are going to definitely tell us that it's dry out there. The fuels, the grasses, everything out there is primed and ready to burn. So using fireworks safely this year is imperative for everyone. And again, I want to emphasize, please, if you are going to participate in the safe and sane, make sure to use them in the city that you bought them, in an area that is surrounded with nothing but concrete. The price of putting out a fire is extreme. And even if you do it accidentally, if you start a fire, very likely that you will be held liable for the price of putting out that fire. So thank you, everyone, for being here. Thank you for sharing this information with everybody that we can. And let's try to have a very safe and happy 4th of July.
Thanks so much. And that was a great introduction for Chief Rhodes with CalFire. And it is dry out there. Curtis, we've talked about the dry conditions. And what is the impact of fireworks with the current environment that we have now, if someone were to set something off in a dry area?
Hey, good afternoon, Mia and team. Can you hear me?
I can, but we lost your camera.
Oh, I apologize. Let me see if I can go
There you
back.
go.
Okay. So as you can hear in the background right now, I'm at the Hollister Fire Station out here off of Fairview Road in Hollister, California. We just dispatched a strike team and our gabbling crews out to a vegetation fire just north of Hollister here near Casa de Fruta. We have been extremely busy this week. We have seen multiple fires started throughout Monterey County. We had a few yesterday that were started in relation to fireworks. In turn, our law enforcement folks are in full staff this week. We have made multiple arrests in the North County region as well as Monterey County over in the Carmel Valley area. So our folks are out there. The grass is extremely dry. And the preparation starts before an emergency. Wildfire safety is a shared responsibility of all these communities. We've seen our defensible space inspectors out over the past couple months working with homeowners to maintain that 100 feet of defensible space. And that includes removing the dead vegetation around the structure, mowing the grass, ensuring that your roofs are clean, your gutters as well. Even with the safe and sane fireworks, they emit sparks that can absolutely start a wildfire. And I thought Matt brought up a great point with that is where you see these fireworks stands being set up and them distributing fireworks, those are the areas or the communities that are allowing fireworks to happen over the 4th of July weekend. Do not go into those areas and purchase those safe and sane legal fireworks and take them into other communities where fireworks are not legal and light them off. It only takes one spark. As you can see behind me with the flags, I'm glad my camera's working, but it's early noon here already, and we already see the wind impacting our region. When we get wildfires, they tend to travel very fast in these light, flashy fuels, especially in windy conditions. So we do anticipate seeing incident activity pick up. We've already seen it throughout the week. We're seeing it currently right now throughout the day, and the 4th of July is not even here yet. As Matt stated, we do hear and see fireworks throughout a lot of these communities already. Even though it is not the 4th of July, we have had meetings this morning with both of the San Benito County and Monterey County sheriffs to ensure that they're going to be out in full effect. And more importantly, letting them know that we're here to assist them with any of the efforts that they see or challenges that they have over the weekend. I want to reiterate to people, stay ready, prepare together, prepare all of your personal belongings, have a plan, make sure that you're going on to the Department of Emergency Management website, sign up for Alert Monterey County. We're putting that information out rapidly at any start of any wildfire, regardless of size. Make sure that you have multiple egress routes out of your communities if needed. If we do see evacuations, make sure you have established collection points set up with your families. And with that, check on your neighbors, especially seniors and those needing assistance during emergency. Let's not forget about them, extend our hand, and make sure everybody stays safe this 4th of July season.
Curtis, thank you so much. And I'm glad you brought up your connection with the sheriff's office, because people who live in unincorporated Monterey County, fireworks are not allowed. There no kind of fireworks, not safe and sane. And they may think that their property is safe to set something off. And that is a bad idea, a bad way to think. And I was hoping you could, expand more on that.
Yeah, that's correct. And Matt actually brought up a great point. Where you can light these fireworks off in there's communities, there's designated areas that you can go out, parking lots, places that are basically surrounded by concrete. Do not take these fireworks out into the rural areas. It only takes one spark to spark any type of wildfire. And I know a lot of these communities are having the professional shows happen, especially on the 4th of July. I would highly recommend that families go and take advantage of those shows. I know that the communities put a lot of money and effort into getting those set up. We've seen a lot of them. They're phenomenal shows that are put on. And even near those shows, there are some areas that if you would like to light fireworks off with your children, they are deemed or designated safe areas. Do not take them out to any areas where there's dry wildland around. And that's even just your normal vegetation in your yard. It could light a normal bush that It may look green, but with the fuel moisture content from these hot, warmer days that we've seen and the wind on them, those shrubs are vulnerable to catching on fire, and those embers can get out into the wildland, and any wildland fire that we have threatens all of our communities collectively. And so I want to reiterate that. We also know that there's going to be a lot of traveling for the 4th of July, specifically since some of these cities do allow folks to do fireworks. So we see a lot of people travel into those areas to light fireworks off or celebrate with their families. So with that, let's be cautious while we're traveling. Have a plan, avoid parking in dry grass, use extra caution when you're pulling trailers, you're out mowing, welding, or doing any of those other activities this weekend, as we're going to see the call volume take off here. We've already seen it this week, and there's going to be a lot of working and moving parts throughout all of the county with the fire apparatus that are on duty and traversing up and down our county already.
And then one last question for the two of you. When should people call about fireworks? And Matt, you said you live in Seaside. You know, if you're hearing fireworks in Seaside, just because if you hear it, it's likely authorities hear it. But what can you tell the emergency agency that you call, or should you call non-emergency to say, I'm hearing fireworks at a certain location? Because I'm sure, you know, over this weekend, our 911 system and other responders are going to get loaded with calls about what people are hearing. But what information should people be able to provide?
That's a great point, Mia. Yeah, most of our cities do not want us calling 911 just to report that fireworks are being used. We do want to call 911 if there's an actual fire, if someone's injured, but you're exactly right. We don't want to overwhelm the 911 system. If everybody called for every firework, the system would be completely overwhelmed immediately. So if you do see an actual fire, if you do see someone injured, those are times to definitely call 911. But each city has a non-emergency number, and I apologize, I don't have a list of those numbers with me right now, but it is very easy to find the non-emergency numbers just to report the fireworks. But please, let's save 911 for the emergencies. And then one other thing that Chief Rhodes did mention about traveling. I think that's a really good point. If you are towing anything, make sure that your chains are not scraping the ground. Many fire stations also have chain covers, which is a small section of used fire hose that you can slip onto the chains before you attach your trailer, and that helps from any chains grinding and dragging along the road. Also, make sure that your catalytic converters and exhaust systems for all vehicles are in good working shape. I know that Chief Rhodes and I have both been on roadside fires where we see fires every about quarter of a mile because people's exhausts are spitting out little bits of carbon. They're just enough to ignite that really dry grass. So anyone traveling, please use caution. And as always, make sure that your vehicle and trailer are in good working condition before you set out on the road.
Thank you both so much for being here to share this important information. We want everyone to have fun this weekend, but stay safe, because you don't want to have the happy holiday weekend turn into a disaster that you can't, you won't ever forget. So thank you both for being here. Really appreciate it.
Well said, Matt. Thank you.
And thank you. Thanks again. Moving on to our next topic now. As our older population increases, so do the number of reports of elder abuse or neglect. It's important for everyone to know about the County of Monterey's Adult Protective Services and their work in safeguarding seniors. It's also very important for us to recognize red flags and warnings about neglect or abuse. So we're very pleased to have Emily Nicholl here. She is with our County of Monterey Department of Social Services, and she's going to tell us all about Adult Protective Services. Emily, thanks for being here.
Thank you. I really appreciate the opportunity to talk about Adult Protective Services. We just celebrated Elder and Dependent Adult Justice Month in June. So I'm going to continue celebrating and sharing what we do. And I also want to acknowledge, I appreciate Curtis mentioning how important it is to keep an eye out for our seniors who may be harmed by these fireworks. So I have a little presentation, if it's okay for me to share.
Yes, please.
Okay. Okay, is everybody seeing that okay?
We see it.
Great. So our program, the mission of our whole branch, which includes much more than just adult protective services, is to empower and serve our aging population and people with disabilities. We want them to be able to live safely and with dignity, ideally in their own homes. And as Maya mentioned, our older population is growing. Right now, 20% are 60 and older. But in just a few more years, estimates are that 25% of Monterey County's population is going to be 60 and older. And therefore, will be able to access adult protective services. So just to clarify who is eligible and who could be referred for adult protective services, it's anybody, any elder or dependent adult who is living in the community in their own home. So this does not include those who are in assisted living or skilled nursing. The Ombudsman program works with folks in those situations. So we're focused on the ones who are in their own homes. So an elder is defined as 60 years and older. That changed from about 5 years ago when it used to be 65. And this has allowed us to do a lot more prevention before they're really starting to age. So a dependent adult is anybody 18 to 59 with a physical or mental limitation who needs assistance with being able to carry out their normal activities and may have difficulty with protecting their own rights. So we respond to reports 24 hours a day. We have a standby team working nights, weekends, and we are there to respond to any calls with concern about seniors or dependent adults. And that team investigates those allegations. They develop service plans and provide some short-term case management. But I want to clarify some really important principles of adult protection because there's some myths about what we can do. I used to work in child welfare, and when we had reports of abuse or neglect of children, if it was bad enough, we could call law enforcement and go with them and remove the children from that unsafe situation and place them in foster care. Adult Protective Services staff do not have that capability. We work with our law enforcement partners to be sure, but we are unable to place them without their consent. So some of the principles include their right to be safe, and they retain all their civil and constitutional rights unless restricted by a court. So unless they are conserved, again, they have the right to make their own decisions, even if we disagree with them, even if they don't conform to social norms. And that means they also have the right to refuse services. So our social workers have got to be really skilled at just getting in the door in the first place, and they are. So when they get in there, what are they going to do? We're going to evaluate the report, see if it applies, how fast we're going to go out. It'll be assigned to an investigating social worker. And we do, at the time of a report is made, cross-report to law enforcement anything that could potentially be a crime. So physical abuse, caregiver neglect, sexual abuse, all of those things are already cross-reported to law enforcement, who then decide how fast and if they're going to go out, and they're on a separate track from us. But again, we do collaborate and work together. The social worker is going to conduct a thorough risk assessment, develop a service plan, and collaborate with service providers and family members. And we work with a broad range of service providers, including behavioral health, hospitals, Alliance on Aging, Meals on Wheels, many different partners. And if the client that we're going out on is not receptive to services, but they're okay with us talking to family members, we share those resources with the family members as well. We can only provide short-term case management because the volume of referrals, as you'll see later, is so high that we really have time just to do our investigation and do some crisis stabilization. We only have 14 social workers doing investigations for the entire county, which goes from Watsonville all the way down to past Lockwood. So we do have one social worker who, with our Home Safe program, who is able to provide longer term case management when we're trying to prevent a senior or dependent adult from being evicted, or to improve their housing situation. And as I stated earlier, we provide a lot of information referrals. A lot of our job is just kind of educating seniors and dependent adults about many things such as scams. So this is a list. You're probably familiar with all of the things that are reportable. And for those watching, think about which one of these you think is the most often reported. And the answer is self-neglect. So 46% of our cases last year were self-neglect. So those are folks who are not taking care of themselves physically. Maybe they're getting involved in scams repeatedly. Maybe their homes are hoarded, or there are concerning situations with where they're living. The other really big one, almost 1 in 4 of our calls are about financial abuse. And so many times it's people who we've never heard of before, that we've never gotten a report on somebody. It's just yet another person, another senior who has been scammed. So that's a big one. The rest of them you could see just make up much smaller percentages. So that's mostly what we're working with. Seniors who need assistance to make sure they're taking care of themselves, and those we want to help prevent loss of their finances. As you can see, this is just in a 10-year period. Look at, we started at around 1,500. 10 years later, we're at over 4,000 reports of abuse. So it's only going to grow as our population ages. So remember, those of you listening out there, you may be the first one to notice something going on with your neighbor, with your parent, with your disabled sibling. And so you might be in the best position to report concerns about them. Your report is confidential. Although many times when our social workers go out there, the client asks who reported or think they know who reported, and our social workers are trained to consistently say, I'm sorry, we're not allowed to provide that information. And if you're ever in doubt about whether to report, you don't need to investigate the situation. Just call us and talk us through, and we'll determine whether the instance is reportable. And then law enforcement, if it's a crime-related thing like financial abuse, physical abuse, sexual abuse, and then adult protective services will each be investigating. So I'll leave this up here for a little bit. How do you complete a report? You do need to both make a telephone call to us as well as make a written report within 2 working days of that phone call. And you can get copies of that form online, the SOC 341. And again, we have standby staff. We have people working 24 hours a day to take your call. There's also a free e-learning if you want to learn more about how to make a report. And I know that Maya is going to be sharing this PDF further, so you'll be able to click on the link there. And this is our phone number. During the day, 755-4466, and then here's our after-hour number. And then for those folks who are living in a licensed care facility, our partners, the long-term care ombudsman, can also be contacted. And just bookmark this number, put it in your phone, 755-4466. That's the best number to call to get more information.
Emily, thank you so much for running through all that. I know it's a lot.
It was a lot. Sorry.
There are probably very few of us that don't have a relative or a close friend that is 60 years of age or older, and that we might wonder, oh, is something happening with them? Or they seemed a little bit different today, and I wonder if something is happening with them. So knowing that is really important. But two questions for you. You mentioned the two most common types of cases, self-neglect and financial abuse. When your responders come in and meet the person who something was reported about, what is the information that they usually need the most? What can you provide them that may help change the situation or the environment that they're in?
Some of it is just talking through. We see a lot of romance scams, and sometimes it's kind of talking through, well, how did you meet this person? And have you ever met them in real life? And, just asking those questions, helping them be self-reflective. We also have lots of different handouts on how to prevent abuse. Also, if they have been scammed, we have checklists for what they're going to need to address, like if their identity has been stolen, all the places they're going to have to go to make sure they can protect themselves in the future.
And I'm also wondering if you could, to help us kind of put it into perspective, could you talk about kind of the two avenues that could happen if a report was made or somebody called you, a case that was investigated, and what happens when maybe nothing, comes of it, and then what might happen with the sample of a case that would escalate?
Great question. So sometimes we go out and it turns out we have families that call reports on each other. And it sort of can be a he said, she said, and it's unclear. There's no evidence that any abuse or neglect happened. And sometimes it's really a misunderstanding of the reporting party of what they saw or what they thought they saw. And so we still provide resources if in the course of our assessment, we see that there might be some needs for that person we're checking out. If we find that the allegation is confirmed, if it is a crime, we cross-report again to law enforcement, telling them this is what we found in our investigation, and we attach our report as well as the original report for reference. And again, they're on a separate track trying to find out if this meets the bar for a crime. And sometimes it does, and then it goes all the way to arrest and that sort of thing. Sometimes especially if we have somebody who's at risk of homelessness, we may see if they're willing to voluntarily work with our home safe case manager to see if we can assist them. Sometimes that can include some financial assistance. It can go on lots of different tracks. Sometimes we see that the person they just truly do not have the capability to take care of themselves. Perhaps they're at risk of losing the house they own because of their either a cognitive decline or mental health issue. So we'll refer that case to our partners at Public Guardian's office, who will do an investigation, and we would consider they're the ones who would determine whether someone needs to be conserved. That's a long process. It's a long investigation. It's court hearings. And that's something like we don't want to do that. We want to try to provide enough support that maybe it may be bringing family members in. Sometimes we're on the phone calling family members with permission from the client, letting them know what's going on with their loved one to see if we can help them wrap around and support this client.
Emily, thank you so much for walking us through this. We're never too old for a safety net, right?
Right.
And we really
And-
appreciate what all you and your staff do.
Thank you. And if you're 60 or older, or you're a dependent adult, you can call us too. So that's a reminder too. It doesn't have to be outside parties. It can be the person themselves saying, I need help, and that's okay. And we will send a social worker out there.
Thanks so much for sharing. Really appreciate your time and glad to have you here today.
Thank you.
Well, this year also marks the 7th anniversary of our health department's Nurse Family Partnership Program. This is really an interesting and extraordinary program. It pairs first-time expectant mothers with visiting nurses who stay connected with the child for 2 years. We're going to hear about how this program is growing and about its positive impacts on local families. We're very pleased to have Ella Harris. She's the Director of Public Health Nursing with our County of Monterey Health Department. Ella, thanks for being here and tell us more about this wonderful program.
Yes, thank you so much for the invitation, and love that we just heard from Adult Protective Services. Now we're going back to the beginning of a family with pregnancy and first-time moms with Nurse Family Partnership. So I'm going to share my screen for a brief presentation. Are you able to see?
It's thinking.
Okay,
We see it.
perfect. Thank you. Nurse Family Partnership is an evidence-based home visiting program that pairs a public health nurse with a low-income first-time mother during pregnancy. And what's really great about this program is that the public health nurse will stay with that mom through the child's second birthday. And so it's a program that sees that builds a relationship between the nurse and the family to see long-term positive impacts. It is a national home visiting program, and it has, with over 40 years of existence nationwide, and it has been in Monterey since 2018. And so I'm going to share a video from Nurse Family Partnership, the National Service Office, that highlights the experience that many participants have going through the program. Taking a moment to load.
When I found that I was pregnant, it was the summer before 12th grade. I was so scared.
It was really difficult not having my mom, my dad. As an immigrant, I didn't know how things were working here.
I was at rock bottom, and I found out I was pregnant. I want better for myself and better for my life and his life.
Prenatal and infant and toddler development may be the most opportune time to make lifelong effects on human development and health.
Nurse Family Partnership's intervention offers a multi-generational effect. Strong moms raise strong children become strong parents.
With Nurse Family Partnership, we support families in meeting their health and wellness goals for their physical health, but also what it means to be a healthy family.
When a mom has confidence in herself and her abilities, she's going to translate that down to her child. It's going to allow her to work with her child throughout many years as they deal with other challenges that they're going to come up against. When you talk with our moms, most often they have challenges such as homelessness, addiction, they're socially isolated, and that's where Nurse Family Partnership comes in.
No solamente la palabra, sino en dos idiomas.
I feel like I'm the support for them, but they're learning themselves, and it's amazing how they learn that they have the power, that they're powerful.
I was in a very bad spot when I found out I was pregnant. I was getting high. I was very nervous and scared. And then I finally sat down and thought, and I went to John Brooks Recovery Center, and I got put on methadone.
It's very common when somebody's going through addiction to have some type of trauma, something that happened in their life that they are trying to cover their pain with their addiction. So I helped her with resources to start counseling.
Dawn helps me with everything, learning how to take care of his needs and take care of mine at the same time.
James is a very happy, alert baby. His development is right on track. Now he's already attempting to try to crawl. He's a gorgeous baby.
Dad.
Katie has helped me with a lot, and I think she might be my biggest supporter, honestly.
With Vicky, I feel she replaced not having a family. She feels like family. She is family now.
She's always there. It's not just for the nurse part. She's there for everything.
I can't imagine having done all of this without having been in the program.
We see long-term effects of the intervention on outcomes that are of unquestionable public health and social importance.
Since 1996, we've reached over 269,000 families. If you can change a family, you know you can change a community.
We're at this point right now where we have the opportunity to really scale up based on 40 years of success. We're going to reach the scale that's going to make a real impact in this country.
I want to just be the best mother I can be. I know there's going to be challenges, but I'm okay and ready for that.
So that beautiful video highlights the Nurse Family Partnership Program, and really, again, that relationship that is built over 2+ years between the nurse and the family that really leads to long-term healthy outcomes for the family and their community. So the goals of the Nurse Family Partnership Program is to improve pregnancy outcomes, improve child health and development, and improve economic self-sufficiency for the family. And we do that through really focusing on the first 1,000 days after birth. During this time period, the developing brain there's a lot of new experiences that the newborn is going through, and some of those positives and some of those cannot be so positive, such as the toxic effects of stress that can lead to unhealthy outcomes. And so that's why Nurse Family Partnership is focusing in on that first 1,000 days and that early intervention and the bond between the child, the infant, and the mother or guardian can create stable and caring relationships that are essential for life. And so that is why we're there in the home doing home visiting in those first 1,000 days with the mom and child. Nurse Family Partnership is an evidence-based program with multiple randomized controlled trials as well as longitudinal studies that have measured the short and long-term outcomes of the program. And these are just some of the trial outcomes. 48% reduction in child abuse and neglect, 56% reduction in emergency room visits for accidents and poisonings, positive effects of reduction in language delays of children at age 21 months. One really amazing thing, because we are seeing the moms during pregnancy, is a 79% reduction in preterm delivery for women who smoke. And then it also goes beyond the health outcomes of mom and baby, with an 82% increase in months employed for the parent. So really wonderful outcomes with the Nurse Family Partnership Program. Here in Monterey County, we have been, Nurse Family Partnership has been here for 8 years. And we did start right before the COVID pandemic. So we actually ended up graduating our first cohort of clients in 2021 and then held our first in-person graduation of clients in 2023. And it's really fun to see the moms and their families and the 2-year-olds by then when they graduate, as it's a 2-year long program. We put them in caps and gowns, and it's a really fun celebration of everything that the clients achieved. Also in 2021, we expanded our services to South County, so we now do cover the entire Monterey County area. And then last year, we expanded our program from 4 public health nurses to now a team of 5 public health nurses. To be eligible, parents do need to be a Medi-Cal member, a first-time mother, so with not having any live births previously. And then they do need to be pregnant when they enroll. And why it's so important to enroll during pregnancy is because that's the time that a lot of great interventions can happen for healthy outcomes for both mom and the child. So if anyone is interested in referring a pregnant mom to NFP, they're welcome to give our office a call. We also have an electronic referral form on our website. And if anyone wants more information, Loretta Franco Espinosa is our supervising public health nurse who's unable to make it today, but she is available also to answer any questions. That's the presentation on Nurse Family Partnership.
Thank you so much, Ella, for walking through this and all the cute baby pictures, of course. But so you've got the referral information up there, but I think there's more to be done, and I'm sure that you do this. The referral is there, but how do the mothers know that you're there? How do what type of outreach are you doing to make sure they know you're there?
Yeah, that's a great question. So we work closely with our WIC partners. So we go into WIC offices to explain the program to clients. We go to OB offices to also talk with the providers around the program so that they can make referrals. We're at community events, letting folks know that we're here. A lot of our referrals also come from graduates of the program whose friend subsequently, becomes pregnant, and they tell them about this great program where they got their own personal nurse that came and visited them in the home, and then their friend calls us and refers themselves.
I'm also wondering if you can talk about an average home visit. If someone were in the program, kind of how would the visit go? What can people expect?
Yeah, so it's really paced for the client. We are a client-centered program, so they set goals for themselves as well as for their family. And then the nurse will walk with them in completing that goal. So maybe a goal is around breastfeeding, that they want to exclusively breastfeed in the first 3 months. And so the nurse will bring in education materials, will support during a breastfeeding session, and just check in on how things are going. Maybe they need a referral to a lactation specialist. The nurse will also help make that connection happen, sometimes calling with the client to get that first appointment, assisting with setting up transportation, just kind of the whole picture that might need to happen to get that client linked into services. Visits can last about an hour, sometimes shorter if need be, and sometimes a little longer, but it's about an hour. And while we are a home visiting program, we do meet clients where they're at. that. So if that means the client feels most comfortable in a park or at the library, or during a break at work, we'll meet them there.
I'm also wondering if you can talk about the outcomes locally that we're seeing. Your presentation had a great slide about what is known nationally about the program. Are the local outcomes mirroring those results as well?
Yes. So as we've been here for 8 years in Monterey County for 8 years, and part of that time was during the COVID pandemic, we still have pretty small numbers of graduates, but we are seeing a lot of the same positive outcomes as the national numbers. A really great breastfeeding rates among our clientele, and great healthy birth outcomes as well. So we are very proud of our program so far.
Can you tell us how many graduates you've had since you've started graduating? Because I'm still seeing those babies in those cute little captain gowns. So you're going to have to tell us how many there were.
Oh my goodness. Off the top of my head, I don't know exactly the number, but we've had several dozen, I'll say that.
But that's good news too. And so for purposes of contact, they can, if somebody's looking for a program or looking for help, because really sometimes people don't know what they're looking for. They just know they need help. So the first place would be to maybe start with the health department and then find you there and put in, a pregnancy help or pregnancy assistance, and they could find you.
Yes, yeah. So we are located in the health department, public health bureau. I believe that the contact information will go out, but if someone also just calls the general health department number and asks about pregnancy related programming, it will get to us. We have a lot of great programs that assist pregnant people, and so even if they don't qualify for NFP, we can help find them a program that they would qualify for.
Ella, thanks so much for sharing about the program and all the great news that goes along with it. Really wonderful.
Thank you.
And thanks everyone for joining us on the news briefing this week. Our next briefing is next week, and we'll see you then.